Thank you, Bruce. We move on now to the next item on the agenda, which is transforming care for people with learning disabilities and or autism. And I'd like to invite Jane to introduce the paper to us. Jane?
Thank you, Chairman. So the paper provides an update really on what we've done in terms of transforming care. We have spent some time at the board discussing this in the past, so I think what I wanted to do was just confirm that we published Building the Right Support in the final service model as planned on the 30th of October. That was received fairly well, I think. There were lots of positive feedback around it. There is an inevitable and understandable sense of this is a great plan, but we've had plans before, so we now have to prove that we can deliver that. I feel that the service, both the combined service between local government and local authorities and the NHS, is probably in the better place than it's been before in terms of being able to implement that. And since the 30th of October, I thought it would be useful just to update the board on what we've done. So we recently published a joint letter from NHS England, ADAS and the LGA, which has gone out to the health and care system. That has set out expectations in terms of what the next steps will be. We have requested that the 49 transforming care partnerships that were highlighted in the report are finalised and confirmed by the middle of December. That will be groups of CCGs, specialised commissioning and local authorities that will come together to commission and oversee the implementation on a wider footprint. We have also asked for first cut plans by early February and final plans by April. The board will know that alongside the Building the Right Support, we published the more detailed plans for the 6 existing fast tracks. And we are using the experiences of the fast tracks and the model that's within the plan to support those remaining 43 partnerships to be able to deliver both the expected bed numbers and improving the community service and on the timescale I've set out. In order to support that, we've got 7 regional events in place where we'll bring together those transforming care partnerships to help them to build those plans, using the expertise of the fast tracks and clinical and experts and people with learning disability to really help. We're developing mobilisation packs which will give people the tools and support they need, providing them with resource and project management support to be able to do that. And in the new year, we're concentrating on delivery of personalisation support so that people can really get to the nitty-gritty of that. As we set out in the paper, or in the report, we will update the Who Pays guidance. That is due to be published. The final draft will be ready by the end of November. We expect to publish that in December, and we would expect that to be implemented very quickly so that we can concentrate on the in-year delivery of the improvements that we want to make as well. And then the final thing I think I just wanted to flag was we were very clear in the report that we wanted to be able to monitor a variety of different things in order to prove and to demonstrate that we're the delivery. And we've identified 3 key areas. The first one is around the quality of life of people with learning disability. We're planning to use the Health Equalities Framework that's been developed for learning disability over several years and is actually a really good tool. We also want to look at the quality of care, and we're working with the Department of Health who are supporting the delivery of some of the metrics around that. They're very keen to be involved in that. One of the things that we have identified is that we want to use quality checkers. Quality checkers are where you have people with a learning disability that support measurement of individual patient experience. We've also identified in the report the need for very good advocacy services and are recommending a range of different options for how advocacy is provided. So the really important thing is that we actually have families and individuals that are able to express the quality of care they're receiving. And thirdly, along the quality of care, we're also looking at always events. This is something that's been developed by the Institute of Healthcare Improvement in Boston. We are piloting that across England, and we're working with Lancashire Care Trust at the moment to pilot our always events, which is going down really well, and we would expect to roll that out. And then finally, the big measure, of course, will be, as well as the quality of care, quality of experience will be, so what does it mean in terms of the increase in community provision that is set up how do we, monitoring that, talking about it, making sure that it becomes very clear. How many patients are able to be moved out of hospital, inpatients, how many people don't need to go into hospital because we've established those services, and then finally how many of the beds are closing as we go through our 3-year plan. So I just thought it was worth updating. Board, very happy to take any questions.
Well, thank you very much, Jane. I mean, the formal examination question for the board is simply to note and take assurance from the update. But let me invite any questions or comments to Jane. Yes, please, Margaret.
Thank you very much. It's a really good plan. One question. You've got very clear metrics about bed closures. The key correlative metric, if I can put it that way, is going to be how the community support comes forward to meet that. What can you do to make sure there is proper alignment there?
So that's a really helpful question, Margaret, thank you. So what we've said is that we want, through the way we govern this is through the Transforming Care Partnerships, will be local alliances. And that's a really important. So the alliance will be both commissioners and a range of different providers alongside people with learning disability and families. So we will have lots of different alliances that will actually do, so there'll be a joint plan. But the really key thing about this is that joint plan will not only talk about reduction in beds, but also explicitly identify what the increase in community provision will look like. And that will vary depending on the needs of the local population and the local services. So if you look at the 6 fast-track plans, they do vary in terms of what community provision they put in place. By having that alliance locally, we'll be able to develop local plans for local people. And as part of the monitoring of that, we'll be able to check that that's implemented as predicted and as planned.
Great, thank you very much.
Malcolm, thank you. As you said, we've had the opportunity to discuss this, and it's very encouraging. But I'd just like us to be clear when we will have a further report back to the board, because I don't think we can stop being really interested in, and want to focus on progress on this.
This is, as we know, a corporate priority for the board and for NHS England. I'm very happy to bring back as many updates as the board want. We will monitor this very carefully, very closely, so we can plan. I've already committed in the past to come and talk and update, so we can do that as often as the board determines it needs.
Right, I think we should certainly agree to do that. I think it's just important to note that this is work in progress. The board, and with Simon in particular, has pressed very hard on this programme. All members of the board have been engaged in it both formally at these meetings but also informally. I had the experience recently of visiting Calderstones with Jane to get a sense not only of what these institutions have been doing, but also to get a sense from service users, from parents and from clinicians and other members of staff of what this programme means within the environment, and to get a sense also that this is not just a programme of institutional change. This is quite profound cultural change in the way in which NHS provides support for service users with learning disabilities and autism. So forgive the board, Jane, but this is going to continue to be a very high priority for us to monitor and to measure performance against the plan. And also please to pass on to your team our gratitude for what we know has been a pretty difficult but productive period of work.
I will certainly do that. Thank you very much, Chairman. And there is no need to ask for forgiveness. This is a very important piece of work, and I would be more than happy to keep the profile very high as we implement it.
Okay. I was only using polite rhetoric, obviously, but shall we take the paper as approved and endorsed? Thank you very much.